everyone. I'm Vanessa Weisbrod, the director of the Boston Children's Hospital Celiac Disease Program, and I want to start by saying thank you to the Celiac Disease Foundation for inviting me here today to talk to you all about advocating for celiac disease accommodations in learning environments. This has been an amazing project that we've worked on with the foundation, both our team in Boston as well as my former team at Children's National Hospital in DC, and we're really excited to tell you all about what we've developed today. So to give a little bit of background, we know that celiac disease affects about 1% of children in the United States, most of whom attend federal and state-supported learning programs every day of the week. These are public schools and also many private schools that also receive federal funding. We also know that celiac disease can have significant effects on kids and their families, but also on the schools that they attend. There are lots of places that kids can come into contact with gluten at school. But first, we know that lots of kids and teens don't always follow a strict gluten-free diet, and most often these transgressions happen when they're eating meals with their peers. Often this happens lots at school, whether it's snack time, in the cafeteria, at celebrations. There's lots of times when food can come into play. Like I said, lunchtime, class celebrations, cross-contact with gluten-containing materials, especially in early childhood, things like Play-Doh, paper mache, art supplies, science experiments, and cooking classes, or as many schools call it now, family and consumer science classes, when the materials they use contain gluten. We know that sometimes kids with celiac are excluded from these learning activities because they need accommodation. And we also know that kids who feel less integrated into school activities are less likely to succeed on the gluten-free diet. And we all know that not adhering to the gluten-free diet can lead to negative short and long-term health consequences. There are also lots of social and emotional considerations for kids with celiac disease. Sometimes kids attract negative attention from their peers when they eat different types of foods, when they have to ask lots of questions in the cafeteria, or when they're having symptoms of a gluten exposure. On the flip side, we know lots of people with celiac disease are asymptomatic, and when they don't have a visible symptom, they can be judged by peers who think that their celiac disease diagnosis isn't real. Students often experience teasing, taunting, harassment, and bullying by their friends, by teachers, coaches, and sometimes the parents of their friends. But the good news is that we believe we can prevent all of these things from happening by simply having appropriate accommodations. So there are lots of federal laws and regulations that govern celiac disease. I'm going to start by talking about those that govern a disability. So the Americans with Disabilities Act of 1990 defines a disability as a physical or mental impairment that substantially limits one or more major life activities. As we all know, with celiac disease, eating, digestion are major bodily functions that are impacted, and so celiac disease is covered. There's also Section 504 of the Rehabilitation Act of 1973, and this prohibits discrimination from all institutions who receive federal financial assistance, including schools, and this would be public schools or any private school that also receives federal funding based on having celiac disease or any disability. And what this law requires is that these institutions design programming that adequately meets the needs of students with celiac disease in the same way they meet the needs of other students. But what's important to note is that the accommodations have to be reasonable. So they have to be things that don't dramatically change the structure of the institution, but they must accommodate the celiac disease diagnosis. Then there are laws that govern food. So we have the National School Lunch Act, which makes gluten-free meals for students with celiac disease. So any student who would receive a free or reduced cost breakfast or lunch would also be eligible to receive a gluten-free meal. The Child Nutrition Act strengthened and expanded the National School Lunch Act by giving new equipment and services to schools to expand the food options that they could give to kids. It also, very importantly, allowed the USDA to set uniform standards for nutrition at school. So what this means, and is so helpful for kids with celiac disease, is that the meals served to all students The meal for kids with celiac disease has to meet those same nutritional standards. So for example, a hot meal for a hot meal, or a meal that has the same nutritional and caloric value of food served to other students. So we wouldn't see dry lettuce as an equivalent for a grilled chicken sandwich. And finally, of course, the FDA's gluten-free food labeling law, which regulates the term gluten-free. So anytime a packaged food would be served to a student in a school, that it must, at a minimum, meet the criteria of the FDA's gluten-free food law. So now, how do we create a way that's standardized to apply all of these laws in schools? So we are so grateful to all of these wonderful individuals who came together to help us do this. We had quite an amazing group. We had providers from 10 pediatric hospitals, 14 education associations, patient and physician advocacy groups, teachers and administrators from public and private schools, parents of kids with celiac disease, students with celiac disease, a lawyer who had just the most incredible expertise in education law, and a gluten-free food manufacturer who helped us do this. And what we came out of these meetings that we held were the 2020 voluntary recommendations for managing celiac disease in learning environments. This document is a set of recommendations that can be applicable in many different types of institutions. So as I've mentioned, public schools, private schools, charter schools, daycare centers and in-home daycares, and institutions that do and do not receive federal funding. The final recommendations were also aligned with the format and detail found in other guidelines, like those for diabetes, food allergy, and asthma. And the reason for this is that we wanted to make sure that when people looked at these recommendations in schools, that they were familiar, that they weren't totally reinventing the wheel. So we developed these to be applicable to any 504 plan that a student would have. So now we are at the phase where we are teaching people how to do this and providing information so that your family and your schools can take advantage of all of this wonderful work. So in partnership with the Celiac Disease Foundation, we've launched the website school.celiac.org, where there is a series of 3 training programs, one for educators and caregivers, one for food service providers in learning environments, and one for parents and guardians of children with celiac disease. This is an entirely free program that is open to everyone to come and to learn about the laws, to learn about creating 504 plans and how you can help support a child in school. So as I mentioned, the program has 3 different entry points. The first is for educators and caretakers. So this would be applicable to people in schools like administrators, teachers, nurses, psychologists and counselors, custodial and cleaning services, transportation, and child care center staff. For food service providers, this would be applicable to food service dietitians, food service managers, the staff that works in the cafeterias, as well as parent lunchtime volunteers. And finally, the program for parents and guardians of children with celiac disease. This module has so much heart in it, where so many parents came together to share their experiences and their kids too. So if you're out there watching, I would definitely recommend taking a look at that. So as you're going through the program, you're going to see lots of great things. Each track has a series of video lessons as well as post-test questions to make sure you've learned the information found in that course. There are videos that have information, case studies, and role play. And each course takes approximately 1 hour to complete, so it's not a huge time commitment. And of course, it's free of charge, so we're trying to make it as widely available as possible. And at the end of the program, you get a certificate of training showing that you have completed the course. On the flip side of things, we know that it's really important for medical providers to understand all of these things. So we've also worked with Open Pediatrics to build a continuing education program for medical providers. There is a CE program for physicians, nurses, social workers, and psychologists. We want to make sure that the information is disseminated at the point of diagnosis so that when a child finds out that they have celiac disease, the care provider is immediately letting them know about these great resources to help them get set up for accommodations of school. And again, as we've heard from many providers, that even though this course is specific to celiac disease, the laws and the lessons that they learn are applicable to many other conditions that they treat beyond celiac. So we've been hard at work disseminating this information, and since we created the recommendations, so far we have used them to set up plans in 33 states that we know about. And we're hoping by the Advocacy Summit next year that the entire map of the US will be colored in, that there are states everywhere using them. So how can you help after today? First of all, read the recommendations and complete this incredible training program. Send the information to your child's school nurse, guidance counselor, psychologist, food service provider, and classroom teacher, so we help them get the right education too. Make sure that your own child has a 504 plan set up at school. Host a meeting for your parent-teacher association to talk about how they can support kids with celiac disease, and use all of the materials found in the training program. Tell your child's pediatrician and gastroenterologist about the continuing education program on open pediatrics. This is a great opportunity for them to learn about supporting kids with celiac disease while also getting CE credits. And if there are any medical providers watching right now, take the open pediatrics course. It's a great way to learn about supporting your kids with celiac disease at school. So thank you again to the Celiac Disease Foundation for having me here today, and I'm happy to take any questions that you might have.